All right, Carliza, we're on. How are you?
Good. How are you, Antoine?
I'm really, really good, Carliza. I'm super, super excited because I'm talking to you today. I'm grateful that you carved out some time out of your busy schedule to chat with me. So, Carliza, obviously, we've known each other for a long time now. It's probably
Yeah,
been over
at
20
least
years,
20
maybe,
years.
I
Yeah.
think. Yeah, and we'll talk about how we met what I know about you and your business. Obviously, you are a dentist by trade. You have your own practice in San Carlos that you share with your brother. And the reason I wanted to interview you is for a couple of different reasons. First and foremost, I think you have a wonderful demeanor and personality that just makes you super, super likable. You're a very warm and friendly and funny
Oh, thank you.
person. And I think, and those are sincere compliments. I think that those are rare in most people, but I find it a common trait in successful people. And I don't think it's the type of thing you can learn. I think you just either have it or you don't. And I definitely think that you do.
Make
And
me blush. Thank you.
yeah, no, absolutely. Um, and then obviously, Alex, my wife, worked for you originally in Milpitas, I think
Yes.
was your first practice, Milpitas Smile Design.
Correct.
And then over the years, you transitioned from Milpitas into the San Carlos office that you're at now. And that's
Right.
been since when?
Since 2005. So we had the Milpitas practice, and Alex was our first office manager.
Yeah,
2001.
yeah,
So yeah, it's been a long time.
it has.
Yeah, exactly 20 years. 2001.
Right. So, and obviously, we're both sort of family people. I'm married. I have two kids. You're married. You have one son who I know has just graduated from NYU.
Yes, he's adulting. He's on his own now.
That's right. Okay. So we'll talk a little bit more about that. So what I wanted to do in this conversation today is just sort of explore and better understand like your journey, your personal journey, how you got from where you were when you started to where you are now. What were some of the things that you learned over the years through those experiences, good or bad? And what sort of advice you have for maybe other people that are thinking about pursuing their dreams but maybe haven't been able to do so yet for whatever reason. What, if anything, do you want to sort of add about yourself that you think would be important for people to know? Maybe give some more details about your practice or whatever you like.
Well, I think you covered some of it. I practice with my brother, my only brother. My mother is a dentist. She's a retired dentist. And when I graduated dental school, I started practicing with her. She had a practice in San Francisco for many years. So she practiced for about 30 to 40 years. And then when my brother joined the practice, the San Francisco office just got too small for all three of us. So my mom actually started the Milpitas practice. So she owned the office first. Then a few years later, my brother and I decided to go on our own, or offer to buy the Milpitas practice from her. That's how we ended up there. And my mom stayed in San Francisco. But eventually, when we started having kids, so our home base has always been in the Peninsula Bay Area. We grew up in South San Francisco. My brother eventually moved to Redwood City. My parents moved to Belmont, and I moved to San Mateo with my husband and my son. But the commute was just horrendous.
Right.
That was the time of the .com days where it was just, starting to bloom. So the traffic and the commute, sometimes it would take me 2 hours to get to work from
Right.
South City or
Yes.
San Mateo. And when I had Ricky, it was, it became more important to have a good quality of life. So that's why we sold Milpitas and started our St. Carlos office pretty much from scratch.
Right.
In 2005. But yeah, it hasn't always been smooth sailing. I mean, there's challenges with starting, starting a new venture, but for the most part, yeah, I'm very happy with what we've accomplished, and we're still, you know,
Yeah,
I'm always learning. I'm always like open to new ideas and
right.
new challenges.
Yeah, so those are two important things, obviously. Yes, there's always going to be bumps in the road. It's never easy. And we can talk about that, obviously. And how you sort of overcame those challenges, what you learned from them. And obviously, perfect segue. Yes. Ideally, we're always learning, we're always getting better. There's always something new to sort of learn and how to improve yourself. So we'll get there, but let's go back. Let's sort of start at the beginning. So I had maybe forgotten, or maybe I wasn't aware that your mother was also a dentist. So it kind of makes sense that you sort of followed in her footsteps. So take me back, talk to me a little bit more about, you know, your childhood. We know obviously that our childhoods have a significant impact on the adults we grow up to be. So talk to me a little bit about, obviously, again, you know, Anthony is your brother. I remember your mom and dad, Papa Mama Da and Papa Gi, I
Yes,
think
yes.
was what she used to call.
So those
So
names came up because in Tagalog, maganda means beautiful,
yeah,
and Pogi means handsome.
yeah,
And Ricky, our first, you know, their first grandchild,
yeah.
my mom wanted Ricky to call her Mama Maganda, Mama
Uh-huh.
Beautiful, and Papa Pogi, Papa Handsome.
Yeah.
But Ricky couldn't pronounce it, you know, and he just kept saying Papa Gi, Papa Gi. Sorry, that's Bentley,
That's okay.
little doggy. But
Yeah.
and then he couldn't say Maganda, so it became Mama Da. So that's
Yeah.
how they got their names.
Yeah.
Bentley, sorry.
It's okay. That's not a problem. Okay, so talk to me about, so again, it was you and your brother, Anthony. When did you know you wanted to be a dentist?
That's a good question. I actually, you know, we grew up in my mother's dental office. So I was born in the Philippines. Both Anthony and I were born in the Philippines. And I admire my mom and dad because we moved here in 71. I was 3 years old and my brother was 2. At the time, there weren't a lot of female dentists. So when we arrived here and she went looking for a job, the doctor, who she literally just walked in. She said she looked at a map. You know, we just arrived and she looked at a map and she took the bus to Market Street, 6 and Market Street in San Francisco. And she just walked into every dental office. She finally walked into Dr. Doan's office, and all the offices couldn't believe that she was a female dentist. Because I think, you know, that it was predominantly male at that time.
Right.
So she started working for Dr. Doan in San Francisco, A.G. Doan, and he was such a great inspiration and mentor for my mom. And she didn't have, you know, they couldn't afford daycare, so he allowed us to be in his office. You know, it's just they set up a room for us. So my brother and I pretty much grew up in the dental office. I think that was part of the inspiration of eventually, you know, pursuing this career, because that's all I knew from, you know, from grammar school up until high school. I remember, I tell this story all the time. It was so, when we were young, we would go to, you know, take the bus to her office after school. We were supposed to be doing our homework. But it was a huge office. It was 11 operatories. So this long corridor, this long hallway.
Right.
And once a week, they would have, you know, the floors waxed. So my brother and I would sneak out, you know, with just our socks, and we'd slide down the newly waxed floor as my mom was doing dentistry. And at the time, you know, there was it was literally they didn't wear gloves.
Right.
It was, you know, wet finger dentistry, literally. And we'd glide by, and she said she could see the shadow going by. We'd play there, and we'd play with the mercury, because we were doing the amalgams at that time. We'd sneak into the little nook and play with the liquid mercury, or sneak into the lab and play with the Bunsen burner and the wax. So yeah, then eventually I said, I'm gonna follow my mom's footsteps. So that's how I you know.
Those sound like wonderful memories. So I'm assuming your mother was probably supportive when you said this is what you wanted to do.
Yeah, she was very supportive. In fact, she was, it was almost predestined, because from a very young age, she was very encouraging. She really wanted me to follow her footsteps. My brother was a surprise, because he had gone to UC Davis and he was going to go into medicine.
Okay.
But medicine has changed through the years. There's not, if you notice, there's not a lot of, I don't know of any more private medical practices. They're all with, you know, Kaisers or big corporations.
Right.
And dentistry, knock on wood, you know, we've been able to hang on where we're still having our own offices and, you know, pretty much managing our own destination versus working for somebody else. So yes, eventually Anthony decided to do dentistry too. So that's how our partnership was formed.
Wonderful. And then what about your dad? I don't recall. I'm sorry if I missed it. What line of work was your father in? And was he supportive of you being a dentist, or did he want you to do something else?
My father was an electrical engineer,
Okay.
and he worked for Bechtel Corporation for many years. He worked on the nuclear power plants, you know, it was called the Limerick project. But at one point they were gonna move him out of state because that's where the power plants were.
Right.
So he retired early, and he joined my mother's practice too as the office manager. So at one point it was all four of us at the office.
Got it. Okay, so you made the decision, your family was supportive, and talk to me about dentistry school. So you went in, you got the education you needed. Can you just explain that for people that maybe aren't familiar with what it entails to be sort of a dentist, and maybe the different type of dentists that there are, because I know there's some orthodontists versus maybe. Can you explain that a bit?
Yeah, well, dentistry, the didactic, you know, part is a very heavy science base. So, you know, if you like biology, you know, anatomy, biochemistry, organic chemistry, that's, you know, just learning the book part of it. So that one I did. So I did a 6-year program. Normally dentistry is an 8-year program, 4 years of undergraduate, and then, you know, another 4 years of dental school. And then if you want to specialize, so specialty is just focusing on one aspect of dentistry, like you were saying, orthodontics, or endodontics is root canals. There's prosthodontists where they specialize in restorative, like, you know, dentures or implant, huge implant cases. Let me see, orthodontists, endodontists, oral surgeons, oral maxillofacial surgeons are extractions and implants, and there's periodontists, those are gum specialists. So there's a lot of different specialties, but that's typically another 2 to 4 years after dental school. So I decided pretty early on in high school that for sure I was going to pursue dentistry. So I applied to University of the Pacific. It's not called Pacific Degoni, so it was named after one of our deans. So I did the 6-year program. Starts off in Stockton, the undergrad studies. So I lived in Stockton for 3 years, right out of high school, and then I went straight to dental school. So dental school at UOP, it's a 3-year program, so it's 3 years straight, and that's how it's the same. It's still 12 quarters, but at UOP we do 3 years of 4 quarters, and other schools do 4 years of 3 quarters where they get summers off. So we basically, you know, we're in dental school for 10 weeks on, 2 weeks off, 10 weeks on for 3 years. So I graduated, and I was 24 years old, so graduated pretty young. And I think if I were to look back and, you know, I wouldn't change my decision, but at that age, I think the hardest part was coming out so young and still a little bit immature. You know, I never even really balanced a checkbook. I mean, just, you know, I learned the life lessons of adulting as I was a doctor. So that was interesting.
So that's really fascinating. I'm glad you brought that up. So you obviously went to dentistry school. So you graduated when you were like 24, so you're ready to be a dentist. But there's another aspect to your business, and that you're not just a dentist, but you're running a business.
Right.
Right. So can you talk to me a little bit about that? Help me understand, was any of learning how to run a business part of what you learned in dentistry school, or in either case, did you have a conscious conversation with your brother as far as who was going to do what, sharing responsibilities, etc.? Because there's a whole other aspect to running a dental office, also, that you're leading a team. You have obviously assistants and hygienists and other staff members. So can you just dig into that for me a little bit?
Yeah, those are really great questions. Yeah, it's multifaceted because foremost, of course, our focus is on health and our patients, but then there's the other side where we're running a business, we're managing staff, we're dealing with the numbers and the bookkeeping.
Right.
So my mother, her practice, she accepted Medi-Cal. I don't know if you're familiar with Medi-Cal. So it's
Sure.
kind of lower income
Sure.
patients. It's great, and she served a need in the community. But unfortunately, with that, they just don't reimburse enough for the kind of dentistry we wanted to do. Like, I wanted to get more into cosmetic dentistry and full mouth cases. So that's where I think my brother and I differed in philosophy with my mom, which is one of the reasons we decided to start our own practice and kind of focus on the things that we were passionate about. So when we went off on our own, we acknowledged and realized from the very start that we needed help with the management part. Because in dental school, at least at the time, there wasn't a lot of training on accounting and balancing the books and learning about what supplies to buy or anything about HR. That's a whole other topic about knowing the law, the labor laws, and making sure that you're paying a staff overtime or exempt versus non-exempt. I mean, we learned that as we went along, but from the very start, we hired a management consultant.
Okay.
So the management consultant, I call her my therapist. She's incredible. So from day one, she helped us set up systems. So we have a system for every aspect of our practice, like, hygiene, like how does the hygiene is cleanings, and how does that protocol work, or how does that flow work? And then, patient complaints, so how do you deal with patients who complain? Because I'm not always going to be in the front, so we have to train our staff to be able to handle that. So yeah, those are things that we kind of learned as we went along. Some of it was hit and miss. As far as the division of labor or how we manage our practice, it's worked out great for Anthony and I, because my brother, he's a numbers person. He likes, he does the books, he does the payroll, he does all that. I'm more of the HR person, so I'm more of the main person talking, managing the staff and making sure that all of even the stationery and the things that go on in the office is quality, and the impression that we want to present. So I think it's been really it's been really great that there is a partnership. I admire dentists who do it on their own. There's a lot of dentists out there who are sole proprietors, meaning they run their office by themselves, and it's a lot. It's a lot to manage. And then on top of that, I'm a mommy. I'm raising this little boy, and I'm fortunate because my husband Chris was very supportive and understanding. And so those days that I especially when I was working in Milpitas, and I would leave at 6 in the morning and not be home until 8 or 9 o'clock at night, Chris took up the slack.
Right. Well, it's always nice to be surrounded with supportive family members.
Yeah, it takes a village for sure.
It does. So it's nice that you didn't have to sacrifice your career and your passion. You could sort of maintain both a healthy professional life and a family life as well. And I'm assuming again, with your mother being a dentist for so long, she was probably able to give you some knowledge and share with you some insights that helped you along the way that maybe you wouldn't
Right.
have known about otherwise, right? So you had an experienced person in your corner who just also happened to be your mom.
Yeah, definitely allowed us, she paved the way. She allowed us better opportunities because, you know, we're immigrants and starting off in this new country with very little family support, and she was raising 2 kids. I remember she used to work 5, 6 days a week,
Yeah.
you know, and I think that because I witnessed that and I saw that, I mean, they're great parents. You know, my dad, he took up the slack because my mom was working so much. But I realized that um, luckily we had the opportunity to
Yeah.
change. So eventually when Ricky was born, I changed my hours to 3 days a week. So I
Uh-huh.
still, you know, I focused 3 days on my practice, and then the other 2 days I was volunteering at the school, and you know,
Yeah.
I was really present for Ricky.
Yeah.
I think to the point where he was annoyed, but but I was, you know, I feel like
Yeah.
uh, I was you know, I was a
Yeah.
part-time stay-at-home mom.
Yeah, yeah. So, uh, and I'm sure he certainly appreciates it now, looking back, being again sort of new in the workforce. He graduated, and can you just update me again? I know he graduated, but he graduated from NYU. He got a degree in what, and he's going to do what now?
So my Ricky he's living in New York.
Yeah.
He graduated in May, and he has 3 degrees. So he has
Oh,
a degree in computer science is his main major, and I think that was the another advantage of COVID
yeah.
is because he had all this time on his hands. So a lot of the classes overlap as far as the majors. So he also got a degree in mechanical engineering. My husband's a mechanical engineer, so
Yeah.
he followed his dad's footsteps there. And then his third degree is in history. I think it's history.
Okay.
Can't even keep track of it.
Okay.
But yeah, so he after college, after he graduated, he decided to stay in New York. During his senior year, he got an internship with IBM. So, and he was doing that all remotely. He was living here. They offered him a job, so he went back to New York. His job is based in Poughkeepsie, which
Okay.
is in upstate New York, but he wanted to stay in Manhattan, and it would have been a 2-hour commute,
Uh-huh.
you know, from Manhattan to
Right.
Poughkeepsie.
Yeah.
But because of COVID, he's doing everything remotely from his apartment.
Yeah.
And he's living the life. You know, he has a girlfriend,
Yeah. Good for him.
and you know, you're talking about the closeness, so it warms my heart because he talks to me about his girlfriend, and
Yeah.
you know, does share that with me.
That's wonderful. And obviously, Alex and I have fond memories of helping
Oh
baby
yeah,
when he was very, very little.
yeah, you guys babysat him.
We did, and it was our first experience, with children,
Yeah,
because we didn't have children ourselves until then. And it's great to see him grow up.
yeah, he still calls you uncle and auntie.
That's great. And again, the fact that he's been so successful academically and sounds like he's well on his way is no surprise, because he had the wonderful influence from you and
Oh,
your
thank
husband as well. So, and I want to talk about COVID, how it affected you in your practice in a minute. But before we go there, I just wanted to sort of finish the discussion around your education.
you.
So
Mhm.
obviously you had your formal education, you graduated, and we talked about early on how every day is a new learning opportunity.
Right.
There's more to learn. What have you done sort of since then on your own, either as far as dentistry or anything else, to sort of continue your education? Are there seminars, are there books you've read, or are there any things that you enjoyed that you took away key learnings that you found valuable?
Yeah, so in dental school, you know, we learn the basics, and I think now, from what I hear, because I have close friends who kids are in dental school, you know, it is becoming more progressive. The students are learning about the, you know, technology, and you know, dentistry. A lot of the things we do is digital, You know, we don't do written charts anymore, digital x-rays, one visit crowns. And that's now being incorporated in the dental school teachings, which is great because they're coming out and they are, you know, at least have the basic knowledge of that. You know, when we were in dental school, when I was in dental school, you know, that was not even really invented yet. So, so I have taken hundreds and thousands of hours of continuing education to keep up to date with the changing technology and the changing, you know, sorry.
Okay, that's all right.
Changing options in dentistry.
Yeah.
But as Ricky got a little older and he didn't need his mom around as much.
So Carliza, you talked about how dentistry has evolved over the years and it's become sort of more digital because of technology, and you've had to continue your education in order to sort of keep up with the times, right? So did you encounter any challenges around that? Was it easy for you to sort of adapt and keep up? Because I imagine there's a considerable amount of investment, not just of your time, but of obviously needing new equipment and, you know, obviously that requires money, and, you know, if there's new technology coming out every few years, it could sort of, so can you talk to me how do you sort of approach your decision-making process? What technologies do you embrace sooner than others? And, you know, how do you weigh what's the right investment?
So it was as far as continuing education, I started off with, oh my God, there's the other dog. Can you pause it again? I'm gonna close the door.
Go ahead. Yeah.
So your question about the technology and all the advances in dentistry. So I wanted to learn more about cosmetic dentistry because at the time, I don't know if you remember the show, the Small Makeovers and shows. So we had more and more patients requesting it, and you know, we didn't really learn doing 10 veneers all at one time in dental school. So I did do some advanced training on that. So it started off with that. Then eventually CEREC, which is the one visit crowns, was invented. So we went to informational meetings first. So we really researched it because it is an expensive investment. I always tell my friends, yeah, that's my Tesla. You know, the acquisition unit. Right. And so before we incorporate anything into the office, we do our research. You know, we went to informational webinars, as I said, or seminars at the time. There weren't webinars. We took, you know, we did some training, you know, on models, on study models before we actually took the plunge and invested in it. And through the years, I say it's just like your Apple phone, you know, they change softwares. Okay. So sadly, as we pay off one unit, another, you know, better, faster technology comes out. So and I feel like it's a never ending cycle where we're constantly incorporating new technology. And I think it's a great service to the patient. It's so convenient. You know, they come in, they get their crown in 2 hours instead of having to come back. You know, now we have Invisalign, which is, you know, the clear braces that was not taught when we got out. So there's this, the point is that we're constantly learning. Sure. And who knows what's going to be around, you know, 5-10 years from now. That's right. And then outside of, so there was, you know, I love my career. I love learning all these things and being able to offer better options for patients. But I also, you know, at some point I felt like I needed more. I needed to be more fulfilled or feel like I was, there was a meaning to my career. Okay. So I started volunteering for dental missions. Okay. And so that is life-changing because we don't realize how good we have it as much as, because, you know, it's so easy to complain every day. Right. About, you know, so, you know, when you look back, it's like really trivial things. Right. And you go to another country where they don't have they don't have the opportunity to have basic dental care.
Right.
And we're at these dental missions, we're doing extractions, mostly extractions, and they're spitting in a bucket.
Oh,
Doing it outside and on lawn chairs.
right.
So that was eye-opening, and I've made a personal commitment. I go on a mission every 2 years.
Okay. And what are some of the countries? What are some of the countries you've gone to?
So I started. So my very first mission, Ricky was only 5, I think. So I take it back. There was a time where I had to take a break because I had to, I couldn't
Sure.
take off for 2,
Sure.
3 weeks while Chris was here alone with Ricky.
Right.
So my first mission, I went to Belize. That was incredible. It was called the Belize Mission Project. And in Belize, I think there were 16 dentists that went. And Belize, they have little islands. They call them Key, but it's spelled Caye.
Yeah.
So I was, and they divided they assigned the dentists to different islands. And we take a boat taxi from the main town to the 2 islands. So I went to Key Cocker, and over there we treated a lot of we treated the grammar school children.
Yeah.
So it's fascinating because when the mission started at that time, I think it was the 7th year for the mission, but they were doing sealants on the kids, and they were following them through the years every time they went to the mission. And they found that there was a lower and lower incidence of caries because of what the mission was doing, just simply putting sealants on these children's teeth.
Right.
So that was my first mission. And then I've done a few, every 2 years I go to the Philippines, a different province in the Philippines. I did Uganda right before the pandemic hit. And that was,
Yeah.
same,
And are
everything.
you doing that on your own, or is it through an organization?
Yeah, mostly with friends. The Uganda trip, one of my best friends in dental organization, organized dentistry. So I'm also involved with, the other hat I wear is I'm involved with the California Dental Association. So I became more involved with organized dentistry leadership.
Okay.
So I met a friend through there, and she was involved with helping to open a hospital in Uganda, but the hospital doesn't have it's in Bwindi, a town in Uganda. They didn't have a dental unit.
Right.
So we went over there to raise money. So we actually donated to helping to create this dental unit within the hospital, and then we went to different areas to do dentistry, literally in the jungle. We were outside, same thing. They were mostly extractions,
Right.
getting in buckets, using gauze to try to
Yeah.
cauterize the extraction site.
And no anesthetics, I assume. Right?
So a lot of the products we brought to these missions were some vendors would donate.
Okay.
So the vendors are very, our dental supply companies were very supportive, and a lot of them donated. But for the most part, we collected expired anesthesia from dental offices that we can't use here because of all the FDA rules. But there's still, good medicine, good,
Right.
so that's a lot. We did do anesthesia, so we did bring stuff.
So it's not like in the old days in the movies with the saw, and a pair of pliers.
No, we're more humane than that, but
I'm sure.
it's definitely not the kind of dentistry we do here.
And all joking aside, I imagine it was probably quite satisfying and fulfilling knowing that you're helping improve people's lives in that way. So would you say that it satisfied your reason for wanting to do it? You said you were looking for more, you're looking for more maybe purpose or meaning. Right. And that's quite noble to even do it once. And it sounds like you've done it many times over years.
Yeah.
So there's a certain sense of probably pride and accomplishment, rightfully so.
Yeah. Yeah. And just gratitude, I come back from a lot of these missions,
Yeah.
and and I'm just with a renewed
Right.
like outlook in life, that
Yes.
when we complain about, I don't know,
Right.
something
Right.
so simple like, it's too hot, or or the
Right.
air conditioner went out, or the heater went out,
Yes.
something. But then you go to these countries
Yes.
where they survive on the bare minimum and they're
Right.
happy.
Right.
They're still smiling and they're so grateful. And they're all the people we treated, all the patients we treated in these different countries,
Yeah.
the one thing that resonates is how grateful and how humble
Right.
they all are.
And wouldn't you say that helping others is one of the greatest callings in life, or at least it
Sure,
should be, right? And
sure.
there's lots of different ways we can do that. In your case, you've gone to other countries and you've really gone to, again, situations that are out of the norm
Right.
and are inconvenient, I'm sure, but probably makes it all the more satisfying, isn't it?
Yeah. Yeah. And even here, I'm very involved with organized dentistry and the California Dental Association, because we see the need here too. There's a portion of our population that, for whatever reason, don't have access to dental care,
Yeah.
and so CDA did free clinics called CDA Cares, and then we had one at San Mateo, and I helped organize that. So basically, it's a dental mission in our
Got
backyard.
it. Got it. Yeah, you don't
So
have to go very far to find
yeah,
people who
yeah,
need help, right?
yeah. So
So again, the fact that you would do it at all, and especially in other countries, like the
yeah,
ones you mentioned, is quite
yeah.
noble. So let's talk a little bit about your practice. I'm going to share my screen. I've got your website up here.
Oh,
Yeah, I've got it
cool.
here. So again, it's Marcos and Marcos in San Carlos. You guys have been there now for how many years?
It's 16 years. We opened in 2005, August 1st, 2005, which is
Yeah,
my son's birthday.
and it's a beautiful location and neighborhood. And here's
Yeah.
some pictures, obviously, of the office. Let's talk a little bit about, you mentioned the cosmetic and dentistry, and you've got some cases here of people that you've helped over the years. And I wanted to talk about this a bit more because I think probably most people, when they think of dentistry, they think again about your cleanings every 6 months and cavities and whatever. But there's a whole other aspect of it, isn't there, where you're helping address people's maybe cosmetic needs, and the change that you can bring to someone's life, the confidence that comes along with that, and the self-esteem. So can you talk about some of the transformations and maybe that aspect of the practice and what that means to you?
Yeah, absolutely. So, I mean, cosmetic dentistry is, we're talking about veneers and even teeth whitening. It,
Yeah,
it can change a patient, not only their smile, but their self-esteem. So that,
right,
um, especially now I found that during this pandemic, when everybody's doing things virtually and on Zoom, they're more conscious of their smile. Like, I found
right,
that you have more requests for cosmetic work. But it's not just that. So also there's patients who grind their teeth, especially
right,
during this time where
right.
we're seeing a lot of broken teeth. We're seeing a lot of bruxism and stress related, damage to their teeth.
Yeah,
So we can build up their smile to where it should be, to where
right,
it's more functional. So
right,
there's the aesthetic portion, but also if you have nice straight teeth,
right.
hygienically and functionally, it transforms your overall
That's
view.
right. That's right. And here's some examples you've
Yeah,
got there,
look at
tons
this
of them.
guy. Yeah, Efren. So I have a great story about this guy. So Efren, when he first came to see me, he is now in his mid 80s. And by the way, all of these patients have signed releases.
Uh-huh.
You can share their photographs. When he first came to see me, I think he was in his mid 70s, and he came in with broken teeth, broken crowns. And I said, we really, it was to a point where we had to do full mouth rehab on him. And he's saying, I'm too old. I don't need the work.
Uh-huh.
And he goes, I'm gonna die pretty soon. I mean,
Oh,
he's almost 90 now. I think he's probably 80, 85, 88, somewhere mid 80s, late 80s. But he's still driving. He still comes to see me.
right.
So I said to him, I said, okay, let's make a deal. When we finish your work, and if you don't make it to 10 years, because dental restorations, nothing is designed to last forever.
Yeah,
Just like any other product in your home, with
right,
wear and tear, you eventually have to replace
right.
it. But we warranty it, where we expect it to last at least 5 to 10 years or longer. So I told him, if you don't make it to 10 years,
Uh-huh.
I promise you, I will take your check and put it back, put it in your coffin. And so now we're like almost 20 years later, he's still, because he was very early, at the start of our practice when
Yeah,
we had just opened our San Carlos office. So he's one of our first patients there.
that's a great story, and I can see the significant difference in
Yeah,
the pictures.
he's so cute. Yeah, he comes in and he talks to me about his family and all his dogs, and his kids are,
Uh-huh.
all grown. So yeah,
The before and afters are really quite astonishing.
it's
I'm
pretty cool.
sure not easy to do, and it takes some time and quite a bit of skill. What's spa dentistry?
Oh, so it's basically just amenities in the practice. Like, this is pre-COVID, and we were doing hand waxing while they're getting
Oh,
their work done, just things to relax them, because we have a lot of phobic patients, or patients who just, I don't know how many times I've heard stay-at-home mom say, is it sad to say that my hour at the dental office is my me time? So
yeah.
so spa dentistry is, hand waxing, paraffin, eye packs. We have a massager,
Oh, yeah.
especially those full mouth cases. Sometimes the patients are in the chair for 4 hours at a
Right.
time.
Yeah.
We have sedation dentistry. It's not considered spa dentistry,
Okay.
but for those patients who are super phobic, we have an anesthesiologist come in, or we have nitrous oxide. I think the biggest win for me is when you have a phobic patient come in and they
Yeah.
get to a point where they just jumped into the chair and they don't
Right.
need all of those different things to calm them down.
Yeah. Well, my youngest son's autistic, and
Right?
getting him to be excited about the dentist would be a dream come true.
Yeah.
And here you are. Obviously, there's a section of your website which
Oh my
gives
God, look how young we have to update these pictures.
and shout out to your brother,
There's
Dr.
my
A.
brother, right?
Yeah, he's a great guy as well. And at some point, I'll have to interview him as well. I know he's a big Matrix fan with the new movie.
Oh yeah.
I think that'll
Yeah,
be a great
change his son,
opportunity.
Neo.
That's right. So you mentioned COVID a couple of times. And obviously it's affected everyone all over the world. Unprecedented times, really. It's been about a year and a half now, I guess. Can you talk to me a little bit about, over the last, year and a half, how the practice has evolved? I'm assuming maybe you were shut down for some portion of time. And
Yeah.
how did you deal with that time? And then, when did you reopen, and how has it changed since COVID?
Um, I I wouldn't say it's changed a lot, because in dentistry we've always followed very strict OSHA guidelines. We've always been we've always had infection control protocols in place. I think it's been enhanced. So my, back in March was when this whole thing blew up, right? March 2020, at least it became um, the pandemic in the United States. I was in the Philippines. I was doing a mission in the Philippines in early March. And so I had taken 2 weeks off to do that mission. I didn't have my phone, but we did know, what was going on, because after our outreach programs, we would go back into it was, I call it a hotel, but it was basically, where we were staying. and we had a television, we could see the Philippine president, talking about COVID and what was going on. But it wasn't until when I on my way home. Actually, let me step back. So the group of us that were in the Philippines, another group of us were going to go to another island to canvass where the next mission would be. But we realized, we got to get out of here because there was, the news was saying that they were going to shut down the airports. They were
Right.
not going to let, the president of the Philippines was trying to manage, the infections. So it was crazy at the Manila airport because everybody was trying to get out, right? So luckily we were all able to get out. But at my first stopover, which is Taiwan, I should say though, back then, I felt safe in the Philippines. Every building we went into, every restaurant, they took your temperatures. They didn't ask the COVID questions, but they were taking our temperatures.
Right.
And then in Taiwan, at the airport, every stop, every gate, they would take your temperature. So I actually felt safer there.
Interesting.
When I got to Taiwan, I turned on my phone and I had like hundreds of messages from my staff because that was when the New York Times article came out, March of 2020, that said that hygiene and dentistry was the highest risk profession.
Oh, really?
COVID. So of course my staff
Uh-huh.
were, up in arms and didn't want to come to work. And so I came back to this storm, right?
Yeah.
And so I contacted my brother and I'm like, oh my God, what's going on? So that Monday, my brother and I decided we were going to shut down anyways because we needed to regroup. Our staff were not in the right state of mind to see patients. The following day, California Dental Association made a recommendation that the practices shut down because at that point we didn't have enough information. They didn't know,
Right.
that it was a airborne
Right.
spread.
Right.
At that time they thought it was still surface.
Yeah.
It's the infection could be spread by just surface
Right.
infection or surface contamination.
That's
So there
right.
were just a lot of unknowns. So we shut down by recommendation of the CDA for 2 months.
Mhm.
So that was tough because, we didn't really have a plan of what to do.
Right.
So
Nobody did. Yeah.
nobody did, right? And we were so unprepared. A lot of so when I say shut down, I shouldn't say we totally shut down. So we're still open to emergency patients as long as we had the PPEs. And that was a big thing. And also at that time, there was a shortage of PPEs because everybody was trying to get it.
And sorry, what is PPE?
Oh, I'm sorry. Personal protection equipment. So, the
Okay.
mask and the gloves. So that was another challenge for a lot of dental offices is that they couldn't open because we didn't have the proper equipment.
Right.
But to answer your question, what has changed since then? And so when we finally came back in June, we implemented new protocols. So we created basically binder of how to handle the COVID. What am I trying to say? The airborne
Sure.
pathogens.
Sure.
And like I said, we were always covered up. We were always in masks, but we have added shields. We do facial shields. We have air filtration throughout the office.
Right.
So we do, we have the questionnaires, just the screening questions. We created basically a pathway where patients come in one way and come out the other. Luckily we have doors, so we did everything we can to keep social distancing, and we changed our schedule so that there was more gaps and spaces between appointments. Since then, though, we pretty much, now that we know more, and now there's never been a case of COVID at a dental office. If staff gets it, they get it outside of the office. They don't
Right.
get it within the office. They're not infected within the office.
Right.
So since then, I mean, we still kept up the protocols. We still do the screening, you know, we still respect social distancing, but I feel like we're more confident and
Right.
more, you know,
Right.
not like it was a year and a half ago.
That's right. That's
Right.
right. Yeah.
But I feel like patients and staff,
Yeah.
I feel we've done everything we could to mitigate, you know, the risk, and it's very safe.
And it's considered an essential service.
And
Right.
yes, and that's another thing that we've learned from this experience is that some of those patients that were emergency patients became super infections because you can only give them so much antibiotics before
Right.
the situation gets worse.
That's
So
right.
we were still playing catch up with a lot of with our schedule, because even the simple hygiene, you know, 2 months of hygiene, we're
Right.
now trying to, you know, make up for all those months they miss.
That's right.
So our practice is still a little backlog, but
Right.
you know, it's all good. We're managing.
The worst is behind us, we hope.
For
Yeah.
sure.
So the last sort of topic I wanted to cover with you, because I want to be respectful of your time, is, you know, what are some of the most valuable lessons that you want to share with maybe young individuals that are thinking about starting a practice, or maybe just even pursuing their dreams, whatever they might be, whether it's dentistry or not? Are any key learnings, sort of, you know, things you would want to have known yourself, you know, 20, 30 years ago, however long it was when you actually started the journey?
Yeah. Sounds like a cliche, but it truly is in my life, at least it's true. You follow your passion, you
Yeah.
know, and it isn't a job, you know, and if you follow your passion, no matter what it is, like you were saying, it could be dentistry, any other career path, it's more of a pleasure. And I think in our office, we really went in wanting to build a practice that you feel like you're visiting family and friends. We really do try to build a family atmosphere. So my staff, I mean, they're like my second family. I see them more than I see my own family. We're with them, you know, more hours of the day. So that, I think, is number one, is just making sure, and you know, if it isn't your passion, or if you realize it's not what is your calling, then, you know, figure it out. Find what it is, because
Right.
especially now with what we've all experienced,
Right.
you know, I think it's brought us back to what's really valuable and what's important.
Right.
And secondly, surround yourself with good mentors. You know, I didn't get to where I am without the help of, you know, my mom inspiring me, you know, dental colleagues, you know, supporting me and helping me if I have questions about dental, you know, dental issues. Organized dentistry is a big part of my life, because if we're not going to fight for our profession, who is?
Right.
You know,
Right.
and just making sure that our profession allows us this quality of living, that I can go out and I can afford to do
Right.
missions, because like you said, it does get expensive.
Sure.
So I think those are the things that I would tell the young people,
Mhm.
you
Mhm.
know.
That's great advice. And the other thing I want to ask you too is, you know, again, you've accomplished so much in your career, and again, you've got so many wonderful qualities that are just innate in you. What's next? What's the next chapter? Obviously, Ricky's all grown up. He's moved out of the house, and you know, obviously, your practice is very well established now. You've got the volunteer work. What's the next sort of chapter? What kind of things interest you that you might want to explore in the future?
I'm glad you asked that, because we're actually, my husband is 10 years older, so he's looking at his exit strategy and, you know, looking at retirement. And I always wanted, like, from early on, I always said, when Chris retires, I want to retire. I want to enjoy our retirement years together.
Yeah.
So we actually are looking for a place in Mammoth, California. when
Oh.
we're not looking, we're in escrow for a
Oh.
condo. So we want to, because he's a big skier, and Ricky is a big climber. He likes,
Huh.
indoor climbing
Okay.
and outdoor climbing as well. But there's Bishop next to Mammoth. So our ulterior motive is that maybe Ricky will come back to California. But anyways, so we'd like to eventually retire in Mammoth, in the mountains.
Okay.
Because, all year round, the summers we can,
Yeah.
hang out at the lake, and the winters are skiing, and it's just peaceful and quiet.
Yeah.
And then organized dentistry. So now that as you were saying, my practice is more established, and we're not worrying so much about how we're paying the rent the next month,
Right.
or the mortgage the next month.
Right.
I am volunteering more for organized dentistry. So I'm in the executive committee now. So I'm going to be president of the CDA. So the CDA is the largest dental organization in the nation. We're under the umbrella of ADA, American Dental Association. But our California alone has 35,000 dentists, and 27,000 of them are members of the CDA.
Yeah.
So it's a huge honor, but also a big responsibility. So I'm preparing myself for that year where I become president. So that's in 2024.
That's exciting. That's exciting.
It
And
is,
frankly, for me, not at all surprising, again, knowing you. And again, you're such a wonderful human being, and again, always warm and friendly and super funny. And I think, again, those qualities, it's no mystery to me as far as why you've been so successful. And
thank
you know,
you. Super funny and
so-
dorky.
what was that?
I said super funny and dorky.
Nothing wrong with that. Same here. Same here. Listen, I want to thank you so much for taking the time to chat with me. I've really enjoyed the conversation and getting to know you better. And you sharing some of these stories has helped me sort of understand your journey better, and hopefully others will benefit from it as well, because I know I have. So Carliza, thank you so much. I really, really appreciate it. I know the sky's the limit for you, and looking forward to hearing more about your adventures as well as
Welcome. Thank you for giving me this opportunity. I enjoyed it.
Good. All right, we'll talk soon. Bye.